Our bone marrow transplant program began in 1979, transplanting just a few patients. We've grown tremendously over the past decades. Today we celebrate our 5,000th transplant patient, and we transplant more than 430 bone marrow or stem cell grafts every year.
We had a huge unmet need. We had most of our patients with acute leukemia and aplastic anemia were dying as a consequence of those diseases. These patients were starting to be rescued with bone marrow transplantation. What we had here at Emory was a strong leukemia program. And when I started on the faculty in '74, my mentor was Ralph Vogler. Initially, there were a lot of skeptics, particularly when the numbers looked so poor at the beginning. But there were converts, very early converts here. Dr. Vogler and myself felt this had a great future. And then these are the folks that process the marrow. There's the nursing staff, which is, in my opinion, probably the most important part of the whole operation. We go in and spend 10 minutes a day with these patients. They spend hours. And the nitty-gritty details that they take care of and the emotional support they provide for these people is just immeasurable.
When I first started, I worked weekends only and had just done one transplant a year. We did not have all the technology we have today.
And back then, we isolated the patient in one room. They were not allowed to leave the room.
It was a team effort. We had one nurse that worked weekends. She would put tacks on the bottom of her shoes and she would tap dance down the halls.
It gets better the bigger it is and the more people you have involved. And then the nice thing that happened to Emory was we were able to bring in some really good people from the outside that were well established in this field. And of course, Rain Sorrell was one of the major finds.
In 1991, we brought a team that consisted of people who worked in the laboratory, people who were translational physicians. That is, they tried to take what we learned in the laboratory and put it into clinical practice to improve outcomes for marrow transplantation.
I was recruited to Emory in 1994 by Rain Sorrell, and I was really hired to help build the scientific platform that would support stem cell transplantation.
It was an exciting time. We really took off fairly rapidly over a year or two. We saw a great opportunity. We seized it and started a program which now, 25 years later, is one of the major programs in the United States.
The care of the patients have changed so much. We have so many more meds now for nausea.
Over the years, with modification and an understanding of the potential complications, we can manage people a lot better today than we did years ago.
Hey Neil, how are you?
March 19th, 1998 was my bone marrow transplant day, and the only reason why I'm here today is because there were a couple thousand before me. I feel a real sense of community in that. We've all kind of gone through something here.
There's about a third of us on the unit now that have been together for 15, 20 years plus. We do look out for each other, and we will celebrate birthdays. We will celebrate, we have people leaving. We will celebrate.
We'll celebrate anything.
Anything.
Our doctors have had years of experience in treating patients, and each of us have transplanted hundreds of patients. We've seen every possible condition occur in one or more patients. We've gained a familiarity with the problems of transplants and the ways to address those problems to restore patients back to health.
You know, I think we're giving people a second chance, and for most of the people on this floor that get a transplant, this is really the only option for them. And so I think that's what keeps us all going.
Oh, there's a lot of pride, though, that we're hitting 5,000 now, and we've grown so much. I mean, it's a long way from 1 or 2 a year.
I probably could retire if I wanted to, but I don't want to. We probably know too much about each other as it is, so we've grown up with each other. I consider this my family, my second family.
It's gratifying to feel that I've made a difference, not just for science, but for actual lives of patients.
Oh, this is a big thrill. I mean, this is death-defying treatments. We can cure somebody particularly somebody that has many years left of good quality life. That's one of the biggest thrills in my career.